want to talk a little about chiropractic massage first. I want to make sure that, I don't say this very often, but this is not an advertisement for me. I want you guys to understand that the vast majority of you live too far away for you to go and come see me for chiropractic. But I wanted to make sure that you guys understand how important this was. One of the most important things is your training, as you're lifting, as you have kids who are in sports, as you sit, as you stare at a computer screen, as you sleep on your side, as you go through life. The body needs maintenance. It needs physical maintenance. The reason that chiropractic actually works is not because the joints pop. It's actually because of the way that the brain and the body work together and communicate together. So when an adjustment is given, the audible popping sound, we technically call it cavitation, is great. It releases pressure. It feels good. And to be 100% honest with you, if you didn't have cavitations, I probably wouldn't do this because I love that sound and it's fun. But it's 20% of the real reason we're doing the adjustment. The reason we're trying to do the adjustment is to is to activate the neurology. So there's little receptors inside the muscles and inside the little ligaments and tendons called muscle spindle fibers. Those are in the muscles. And Golgi tendon organs. Those are in the ligaments and tendons. And those tell the brain different things. And as you give a quick stretch to them and they freak out, and they send this giant barrage of information to the brain has to take all that information and they go, okay, what's going on? And then has to send signals back down to that joint, that muscle, that joint muscle complex, and assess tone or how hard it's pulling, function, whether or not the joint's moving properly, and if the joints are doing what they're supposed to do, and then relaxing the musculature and changing the way that all that stuff holds itself. That's super critical. So, I try to get adjusted 2 or 3 times a week. Again, I'm training at a very high level. And I try to get at least 2 hours of massage a week. Now, the massage thing and the chiropractic thing to a degree, I think a lot of times people look at chiropractic and they specifically look at massage as frou-frou luxury things you do because you want to pamper yourself. Okay, that's fine. That's a thing. It's comfortable. It feels good. Yeah. But just because you enjoy something doesn't mean it's not critically beneficial to your body. I like getting massages. They do feel good, but they also move all the waste out of my muscle tissues. They help get all that nasty lactic acid and all the stuff that's bound up and all the, goo that's in there. It helps move it out. It helps move it into my lymphatics. It helps move my lymphatics through. It helps clean all the inflammation that's in my body. And one of the major pieces of recovery is decreasing your total inflammation. So, making sure your liver and kidneys are open so that your body can detox, the exit portals are open is great. And it's super important. And we talk about that a lot. But physically moving the sludge out of your muscle tissues, out of your lymphatics, moving that stuff out so your body can, get rid of it easier and faster, super important. Massages can help break up muscle spasms, as well or better than anything else. So, having somebody stick their elbow into a knot and work on it and break it up so it will relax, then allowing even more waste and lactic acid and stuff to get out and nutrients and oxygen to get in. Super duper important. So I don't want people to think that, a massage or an adjustment is something they do, for luxury. It is 100% something that you're going to have to do for maintenance. Like if you sleep on your side, what's going to happen is you're going to compress your hips. As you compress your hips, the SIs, that where your sacrum is, the tailbone, a little triangle in your back, right below your spine, that we call it the keystone of the spine. That piece is going to get jammed up against your ilium, or what people think is your hip, and it's going to get moved. And as you compress it and compress it and compress it, it's going to start destabilizing the pelvis, giving you low back pain, giving you hip pain. If you're a woman, giving you knee pain, changing the way you walk, weakening, changing the muscular function of the hip and leg. So there's lots of things like that you just need work on. You need to get those things put back together. So if you don't have a good chiropractor, find one. Not all of them are great. Not all of them are great for you. So for instance, I'm really good at what I do. However, if you have a baby that needs its head reshaped, like mine, so Zane, my oldest, had a really, really prominent cranial ridge. He literally looked like a Klingon. Like if I got to find these pictures because like they were shoved together into this massive cranial ridge, and his head was all lumpy. And so I hired a pediatric chiropractor to take care of my wife and to take care of my kids. Her name is Dr. Kelly Byrne. She's at Forever Young Chiropractic. She's phenomenal. And when people call me and they go, hey, I've got a kid who's got a lumpy head, they need cranial reshaping, or they need a helmet, they have, uneven head. Can you work on that? And I tell them I can. However, the best person for that is not me. It's Dr. Byrne. Go see Dr. Byrne. Dasha's in her practice too. She's phenomenal at this as well, but they specialize in that. And so I would try to get people to go see them because they're the very best at that. You might, I have a lot of small women who come see me because they like a deep physical osseous adjustment. I have older people who come in that I use the activator on, so like that, different techniques, different styles for that individual person. So you might come see me and go, not my style. Bethany, my associate's fantastic too. Maybe that's more your style. Or, we can find somebody who, upper cervical is a technique that I do, but I don't specialize in. And so if you need that, we can find the person who does that. So you might know a chiro and it might be okay. Maybe they're not the best for you. Maybe they're just not very good. So shop around and find the doctor, the guy, the woman, doesn't really matter, who's really good at working on you, because that's going to be important for your health long-term, especially if you're in sports, especially if you're training. I always make the joke that CrossFit was secretly designed by chiropractors to ensure a steady flow of patients forever. Because people who enjoy CrossFit, they get to know their chiropractors really well, or they get to realize that they don't get to compete very often because they're always injured. So it's a really, really important thing. And I want to make sure that I, mention it because I don't think I have to the degree it warrants it. So if you're not getting adjusted on a regular basis for your wellness, for your health, super critical. Keeping the information from the body to the brain and from the brain to the body flowing is super important. The research shows the weight of a dime, or 10 millimeters of mercury, is enough to start interfering with nerve flow. And that's not just pain. That's, are my joints moving properly? Are my organs functioning properly? Is the lymphatics working? Like, it's all that stuff. So that's what the adjustments are really important for. Now, I know that we get a lot of flack from the medical industry about how, no one should come see us and we're quacks and it doesn't help. But remember, their primary mission in life is to sell you drugs daily. They want you on a daily drug, if not 7 daily drugs. If you get adjusted and your lymphatics work, you have less fibromyalgia, you have less pain, you don't need anti-inflammatories, you don't need muscle relaxers, you don't need a lot of that stuff. You can get out and you can exercise, you can move, you don't need the surgeries and the injections and things like that. So, we're counterproductive to the medical, not the individual medical doctors, but the medical industry's goal of getting everybody on all the drugs they can all the time. So, of course, they're going to be taught that what we do doesn't help, but they're also taught that diet isn't important and that exercise isn't important. And if you say, no, my doctor says diet and exercise is important, what have they told you to do diet and exercise wise that was accurate? If they haven't given you accurate functional information on how to make your life better with diet and exercise, then they haven't been telling you to do diet and exercise. Everybody who comes in, I give exercises for your hamstrings, for your neck. I tell you how to sit properly. I tell you how to move around so that you conform your workstation to your life, not your life or your body to your workstation. So things like that. We talk about glycemic function. We talk about, all the things we talk about here. So that's one of those things. But the adjustment is actually very neurologic. It's very important. So, and again, most of you don't live within 15 minutes of my office. So this isn't a for me, this is a for you thing. Find a good chiro and find a good massage therapist. I know it feels good. I know you guys like massages. And so you think, oh, this is luxury. This is, something I don't need, but I enjoy. No, you need it, especially if you're training. If you've got teenagers, if you've got kids who are working out, who are training hard, who are volleyball, softball, soccer, football, gymnastics, doesn't really matter. Getting that lymphatics flushed out, getting all the goo flushed out is super important. Those massages are really, really important. And it will help their performance and it will help them stay healthier. It's going to do tons of things that are beneficial for them. So get your kids adjusted, get your kids and to see the massage therapist. You guys need to get in and do it. So, that's going to help tremendously. So I want to make sure that we pointed out how actually important the chiropractic and the massage piece of this is. So if you guys aren't seeing a chiro, I would start trying to find one, because there's a lot of little things that nag and this and that and cause irritation here and there, that if we can get maintained, dealt with on a more regular basis, they don't become a bigger issue later. So for instance, I see people in here all the time and they didn't want to come in for this reason or that. Had they come in when the problem was starting, it would have taken 2 or 3 adjustments, and then they could have come back in next month for 2 or 3. But because they waited too long, it's, every day this week and 2 or 3 days the next week, and you got to wait 3 or 4 days. And so they end up going 10 or 12 adjustments in a month instead of 3. So that's what happens quite often. So if you guys will kind of recognize that your body needs a little bit more physical maintenance and get in to get adjusted a little more often, it'll help you long-term, both in the amount of adjustments you actually need and how your body functions. So now I can't comment on how other people run their practices. I don't, unless it's a decompression plan, I don't put people on these, you have to come in 3 times a week for 3 weeks for, the rest of your life type of thing. It's how is your body functioning? How is it responding? I'll tell people, we adjust today, you come back in tomorrow, we adjust you again, we should see 30 to 40% of the problem gone. As we get to the point where you start feeling better, we start spreading you out. So, you might come in for like a herniation or something like that frequently at the beginning. And then if you're like, hey, I felt good today, and we went 2 days and you still felt good. Okay, let's see if we can go 3. Let's see if we can go 5. Let's see if we can go 2 weeks. We kind of figure out where your body needs it. Depending on, so for instance, I need a lot more adjusting because I'm putting a lot more force and pressure in my body. So I need more maintenance. The harder you push a machine, the more maintenance it requires. That's just how it is. And that's psychological stress, that's physical stress, that's all of it. So, but on the other side, we know that there's gonna be a maintenance thing needed. I've got people who come in twice a month. I have people who come in twice a week. It just depends on what their body needs. So I'm not gonna try to comment on the best treatment plan that other docs are putting together or that you need, because I haven't evaluated you. But that's one of those things. Not everybody dictates that you come in 3 times a week for the rest of your life. So find the doc, find the program, find the thing that fits you, your lifestyle, and your body better. Again, what are your goals, and how do we apply the tools we have to better suit your goals? That's the biggest thing. So anyway, if you guys have any questions, hit us up, questions@chalmerswellness.com, drop them in the comments, and we'll get these things knocked out. It's good talking to you. Thanks for your time.